So we know that these children coming into care leavers have experienced often significant trauma, adverse childhood experiences, and we're really keen that the voice of the child is absolutely centre of all the care that they receive, that the care is child-led, individualised, hence they stay with the nurse. We try to encourage independence with all our young people. Quite often they are living with foster carers, don't have access to family who would support them with accessing services, so that the nurse would do that as part of the review health assessment. As they get older, then it's about having that independence, that confidence to be able to access services independently, and throughout their lives, that is a key skill that these young people need to have, as with any young person, minus the parent carer in the background doing that support. So it's easy to assume that young people that we're working with are tech savvy and able to use digital platforms, social media. However, one of the things that we have encountered is perhaps that's not necessarily the case. So it's supporting and empowering these young people. This is used not just in healthcare, but day-to-day life. People order the shopping, accessing dental appointments, you name it. There's a whole raft of resources that are needed, accessed digitally, and this is about supporting and empowering these young people.
So for children in care from 16 onwards, the focus becomes about preparation for adulthood, and it's about us equipping them to deal with life once they've left care. So one of the things that we have to do is provide them with a health passport. And a health passport basically is providing them with all that health information that a child would normally be getting from the parents. So information about what happened at the birth, information about their vaccine records, what immunisations they've had, any illnesses that they might have had, things that a parent would normally be able to tell a child, but if a parent's not in that child's life, then they haven't got that there. So that's what we provide, the health passport. It's much more than that as well, because we're also telling them about how to navigate the health system, so how to get prescriptions, what to do if there's an emergency, how to access emergency care, how to register with a GP, how to go to an optician's, how to go to a dentist. So all the things that we take for granted that somebody at some point is going to be pointing out to us, that's what the health passport is all about. We provide them with a paper copy, which is like a little booklet, and they can add as much information to this as they want. But realistically, we know the teenagers, they're going to lose this. So by using PKB, we'll also be able to give them the digital element as well. We've been involved with the process right from the start. We've designed the templates so they match the booklet. So how we use PKB is exactly how we use the paper passport. So we're giving them the same information, we're giving them a paper copy, but we're also giving them a digital copy as well. The digital side of it, we're able to keep live. Once we've given them this paper copy, that's it. They've got the paper copy. We can ask them to update it, we can update it. Whereas the digital version, we can update it as things come in. It also enables them to message us directly, which is so important. And it's probably the first time that they've had that opportunity to message us directly. I think by using the messaging service, it's giving them that voice, it's giving them the direct contact that they've not had before. They're able just to log on to PKB and messages. They don't have to explain to anybody else. They might have some information that they want about their health. They can come straight to us, and then we can look at that and we can deal with them. We can talk to them directly without involving anybody else. We've had one person in particular who's in a really vulnerable position, and she really reaches out to us. We've not had direct contact with this young person before, but actually she obviously feels really safe using PKB and is able to ask us all sorts of things through PKB, which has been a really positive experience for her and for us as well. You know, we're a Monday to Friday 9 till 5 service, so we make it very clear that that's when we'll be accessing the messages and that's when we'll be getting a response. What we do have with the PKB as well is we have a library of resources. So if a young person was feeling distressed and it was the middle of the night, what they could do is log on to PKB, check the library, see what is available to contact at that point, and then have somewhere to go with it. And it's a trusted source. It's something that we've put on there, so we are confident that they're accessing the right support and the right people. Traditionally, what our nurses would do is we'd go out, we'd see the young person, we'd do the health assessment, we'd have a really good conversation, we'd come away, we'd write a report up, that would then go to the social worker, and then we wouldn't have any contact with that young person for another year. So things that we've discussed in the health assessment and we've promised to do, make referrals to the appropriate people, we would do that, but there was no way that the young person would know that we've done that. So by using PKB, we can then message them to say, we've followed up with what we were discussing in your health assessment, we've made this referral, you should be hearing from them shortly. So that they're aware, and it's that reassurance, again, it's giving them that direct contact with us. But I think my vision for it, and as it develops, and as social workers and carers get more used to using it, I think it will be something where everybody can look at a central point to see what's going on, and so that everybody's aware what's happening health-wise for that young person. But again, it's the young person that's right in control of that. You know, they don't have to let the carers see it. They don't have to let the social worker see it. It's there if they want to. So it's about them being in control.
So for me, as a children in care nurse, it's really important to ensure that we're able to empower young people to have that information so that they can do that a long way from maybe where they might be from us, you know, in the journey of their life. It matters to me so much because it's something that we all fight for so passionately at work, you know. Our young people really need to know that it's so important for them to make healthy choices, because often what happens is they don't really understand what their adverse childhood experiences have how that's impacted on their ability to continue to grow and thrive. We want young people to believe that they can do it. As you know, it's not about us owning it, it's about letting them own it, and about them believing that they can continue to go on and manage their health. They are leaving this position of having lots of people around them, monitoring everything and meetings, and it all feeling very, but actually now this is life and it's you and this is yours and it's yours to own, isn't it?